If I treat them as clients, I would take out the empathy and the sympathy out of the whole thing. They just want, give us patient time, let's make the money. Patients were treated as patients, not as something that you want to make money out of. I was really bothered with it. So that's what really inspired me, that I should have my own place where, I could treat my patients the way I want to treat them. So that was one of the major turning points. Yes, let's have our own place.
Right.
I will do Botox for you. I will do your skin rejuvenation for you. I'll do everything for you in a single sitting. Just hand me over your kidney. Our South Asian skins are the best kind of skins. Our color has been decided in our genes. It's in our DNA. We cannot change our skin color. This needs to be understood by Pakistani people, young people especially. They don't know what they need and what they don't. AI is telling people they should get this done. People put in the picture, this is what I look like. And how can I look better? Then AI tells them this is how they can look better. Then they come up to you and they tell you, okay, oh, AI was telling me this, so how about we get this done?
That's not even her face.
Yes, that's not even her face.
She has to live with it.
Major concern for men has always been hair. Hair loss is something that majority of men come in for. Gen Z is now getting into it. They want hydra facials done. Now they want to have brighter skin like the girls. The guys should be rough and tough. But everybody's a dermatologist because aesthetic physicians सबको बनना है.
वो जैसे होता है ना पाकिस्तान, everybody is a property dealer because वो सब आसान काम. Assalamu alaikum everyone, this is Ammar bin Salim. Welcome to another episode of Out Loud with Ammar. Today we are back to you with another Out Loud with Ammar podcast conversation. This is episode 4 and we're continuing the recordings for our season 5. And in the past we have spoken to you about various topics that concern our lives. For instance, we've spoken to you about education, what's happening in the economy, development sector, communications on the whole. And today we are digressing a little bit from the topics that we have discussed in the past, and we're going to talk about something that we have not covered ever before. So it's a new topic. I'm sure that you're going to enjoy the conversation because I'm also as naive as some of you would be. But yet I'm willing to learn and to explore this world of skincare. So today we'll talk about dermatology, skincare, how to take good care of your overall well-being and how it relates with skincare for sure. And I have just the right person for it, somebody who not only is a qualified doctor in this realm, but also runs their own operations in terms of a business that they have out of Islamabad. So I'm very, very privileged to be in the presence of Dr. Maimoona Mumtaz. Dr. Maimoona, Assalamu alaikum.
Walaikum assalam.
How is it coming along?
Oh, good. How are you?
Very well, alhamdulillah. How do you feel after the day is done and the patients are gone? Now we're having this conversation.
A little tired, but quite excited.
And so are we. Dr. Maimoona, before we delve into the hardcore dermatology and aesthetics and what people come to you for and the kind of problems they share with you and the solutions you provide, the first question is always about you. Right. So thoroughbred Islamabadi.
Yeah, I was born and raised in Islamabad, did my schooling over here, went to Bahia College, E8 Naval Complex.
Right.
Did my schooling there.
Margla Avenue picture.
Yes.
Margla Road picture.
Yes, right.
The famous Beria.
Yes.
Conclave.
And then I got into Rawalpindi Medical College. Now it's Rawalpindi Medical University.
Achha.
And did my MBBS from there. House jobs, दो जगहों से की, Holy Family से, which is affiliated with Rawalpindi Medical College.
Right.
And then from PIMS.
Okay.
And then I took a sabbatical because शादी हो गई, बच्चे हो गए.
Right.
And but I wanted
before
to
you could practice.
Yeah, before I could practice, and फिर ये हुआ कि नहीं डिग्री नहीं ज़ाया करनी, बच्चे बड़े हो रहे हैं, let's do something.
Okay.
Then I looked into specializations, and derma really grabbed my attention. So I wanted to go there. Here I applied to different hospitals and got into military hospital Rawalpindi.
Right.
My specialization, I did my MCPS training from there. Okay. And in 2020, I did my MCPS paper exam, cleared it. And now, alhamdulillah, I'm a qualified dermatologist, consultant dermatologist.
Amazing. So how did this idea come to mind? Because many of the dermatologists that we know are the ones who are working with an established business or something, but you decided to have something of your own, and we'll talk to you about the difficulty of the landscape as well. But how did this idea come?
Well, a number of factors to be very honest. As we were talking about this previously as well, कि बहुत सारी जगहों पे ये होता है कि businesses are, hospitals are run by what we call SATs.
हाँ,
They are not doctors themselves, they are just people who are investors.
Okay.
So they don't know the nitty-gritty of what a professional like doctor is, like what goes behind all the medicine and everything. They just want, give us patient time, let's make the money and let's just do everything, you know. So that really I was really bothered with it. Okay? And the kind of places I had worked before in my, like in Holy Family or PIMS or military hospital, the environment was very professional. The patients were treated as patients, not as something that you want to make money out of.
Okay.
So that what really inspired me, that I should have my own place where, you know, I could treat my patients the way I want to treat them, not as somebody who is above me wants me to treat them. So that was one of the major turning points. Yes, let's have our own place.
Right. And so, like, is it easy to have a business in Pakistan?
Not at all. My goodness, it's so tough.
I mean, it's a tough thing to do for men. I mean, let alone for women. I mean, I'm not stereotyping or anything, but it is.
People do stereotype a lot. But the thing was, when we first, I thought back in 2022, you know, business start karte hain, and everybody was like, no, the economy is not stable. Don't do it now. Don't do it now. Then 6 months passed. The economy was still not stable. So I was like, the economy is never going to be stable in this country, but we have to do, I really want my own place. I want to run my own business. So then in start of 2023, I started looking for places of my own, started talking to vendors about machines and all that stuff. And Alhamdulillah, then in June 2023, I opened this place.
And how did you, come up with the money? Did you have your savings or what, like?
Yeah, my husband and my family, my mother and my brothers, they really helped me out in this regard. Like, we put all our savings into it, everything. So, but yes, I had support from my family. And start mein to we were putting in money from our own pockets into the business. But after 1 year, yeah, we have been quite successful. Alhamdulillah, it's going good. I have a very good patient follow, and like people come back. That's the thing that really matters in this business.
Right.
So yeah, now we are good.
Except people also say, so you also wrote an article in Business Recorder the other day, and it was the patients that come to you, they're not your clients, and you are a doctor first.
Yes.
What made you say that? Like, they're not your clients?
When we talk about somebody as a client, for me, they wouldn't be, a client can be anybody. They can have, they're not patients, like they don't have any skin issues, they don't have medical issues. So fashion designer would have a client, a salon owner would have a client, a car dealership would have a client I have a client who's willing to buy cars. But when a person comes to a doctor, they are always supposed to be patients, because we are looking not just at them as a person, we are looking at the whole thing, the 3D thing, that this is a human being, he or she has this issue that me as a doctor has to resolve.
Right.
So I would never, and I think if I treat them as clients, I would take out the empathy and the sympathy out of the whole thing. That bas bechna hai wala scene aa jata hai.
Procedure maine apna bech dena
bas. Come, let me do this and this for you, and you will be like what Katrina Kaif maybe.
All right. So I mean, like, how does this work in the whole situation? Because I mean, if we speak about the industry at large, I'm sure there would be many businesses who will be treating their their patients as clients.
There are.
So what are like some of those exploitative practices that are currently taking place in the industry, in the aesthetics industry?
From what I have seen, what I was telling you, if you think of a person as a client, a person comes in and you tell them, oh, let's start doing this. In this single sitting, I'm doing fillers for you. I will do Botox for you. I will do your skin rejuvenation for you. I'll do everything for you in a single sitting. Just hand me over your kidney.
That's just that costly.
Yeah.
Achha.
So everybody comes in with a budget. And I think if you're selling things, then you don't consider the other person as a human. Iska budget ho sakta hai. You're just selling your stuff around. So there are a lot of people who do that. कि बस आज आ गया है बंदा, let's just start on them. So what I like to do is honestly कि if I am going to do some procedure that the patient does not know of, I tell them go home, do your study. तो Google है, chat GPT कर लो what I am going to be doing on you, so that you are of a mindset कि भाई ये होने वाला है मेरे साथ. तो ताकि I'm not leading you in a dark tunnel कि भाई बस चल पड़ो उसके पीछे. तो लेकिन बहुत सारे practices ये नहीं करते.
And is this in Islam जो आप बता रही हैं?
No, it's everywhere. There's a policy कि patient ने अगर procedure नहीं कराया and they walk out of your door, then they're not coming back.
Okay, so you don't let them go out of the door.
That's the policy, journal policy around, yes. कि कुछ करवा के ही भेजना है.
ताकि वो फिर दोबारा भी आएगा अगर उसको मसला
हाँ, exactly. फिर वो मसला solve करने बैठ जाओ.
Right. तो फिर मतलब वो एक chain बन जाती है for regular income to keep flowing.
Yeah, you could say that.
Right. Okay. So and when we talk about Gen Z and millennials or Gen Alpha as well, so how do you see the fashion trends changing between the three generations?
Okay, if we start from like एक बहुत ही common saying है आजकल, everybody is talking about this, but एक memes भी बनी हुई है कि why do millennials look younger than Gen Z? Millennials are aging backward. Because for me, from what I have seen, millennials have been very conservative about which procedures they want to get done. They are not going all in कि बस ये trend है तो let's do it.
Okay.
They talk to you, they know their mind, they know what they want to get done. This is how they want to look.
Okay.
They are not chasing after a mirage. जिस तरह के मैंने हाँ कि Kardashians की तरह बन जाना है, इस तरह की lips चाहिए, इस तरह की eyes चाहिए, इस तरह की nose चाहिए. No, they want to be themselves, but in a better way. While Gen Z, बस उनको तो बस वो कहते हैं ना कि बस अब्बू के पैसे हैं और बस कुछ कर लेना है.
Okay.
The young brides on 25, 26 come in, they want defined jawlines क्योंकि जो है हमारे photo shoot में picture में jawline अच्छी आए. So those kind of things, and everybody looks a copy of each other.
Okay.
This client, she came in from UK. She was telling me something very interesting. She said कि मैं एक जगह coffee पी के I went to the other side of London and there was the same barista over there. And then I realized, no, they're not the same. They're different people, but because of all the procedures that they've gotten done, they look the same.
Goodness.
So Gen Z का ये मसला है कि they are all becoming carbon copies of each other. So, and Gen Alpha, I have Gen Alphas at home.
Right.
And they are my younger daughter, she's 10 and she keeps on asking me, Mama, when will you be doing my lip filler? And I'm like, don't show me your face. Yeah, I'm not doing anything for you. But yes, the beauty industry is bringing out skincares for 12 years old, 13 years old. Right? They don't need anything.
So when do you think that somebody starts needing these products? The first time, what should be the ideal age, before you apply an aesthetics product to your face or skin?
This all depends on your skin type. If you have a dry skin type, all you really need is a good sunblock and a moisturizer.
Okay.
And your teens. But if you have oily skin and you have acne-prone skin, then yes, we would prescribe you something for, to keep the acne at bay.
Right.
So that you don't get acne scars and all those issues. Baki, I think 20. After your teens, yes, you should start a little vitamin C, but moisturizer, add that to the moisturizer and sunblock that you have. And then after mid-20s, that's when you should start your retinoids, but not before that. And if you are starting on your procedures too early, then it will make you look aged.
Okay,
yes.
Right. So not before 20.
Yes, not before 20.
Not before 20, right.
Unless you have acne scars.
And what do you see, most happening in Pakistan? Like, what's the skin type of the Pakistani people in general? Like, is it like dry skin thing, or is like most of the people in Pakistan have oily skin, or like?
Generally, teenagers only come in when they have acne.
Okay.
So, I wouldn't say that, you will have dry skin, or it's all genes. Some families, everybody has acne in some families. In some families, everybody has dry skin. So
right.
It's a mix
of the two.
Yeah.
Okay, right. And so as far as strange things that happen, so what's the strangest thing that the patient has ever asked you to do?
This woman, she wanted to go 4 to 5 shades lighter. So
is that even possible?
No, it's not.
That's, right.
Our color has been decided in our genes. It's in our DNA. We cannot change our skin color. This needs to be understood by Pakistani people.
Right.
But everybody wants a lighter skin tone. It's all the colonial, effect that we have. So yes, 4 to 5 shades lighter, and then you tell them it's not possible, so they are like, you're not a real doctor. Oh, and the strangest thing, a lot of people come in and ask me, oh, dermatologist doctors bhi hote hain?
So, like, yeah, I mean, I'm sure that would be a misconception for a lot of people. Maybe you could clarify it. Like,
Yes, we are doctors. In fact, we are specialists. Dermatologist is a specialist who specializes in skin, hair, and nail diseases.
Skin, hair, and nail diseases.
Yes.
That's what a dermatologist is.
Yes,
Skin, hair, and nail.
जिस तरह आप gastroenterologist के पास जाते हो, या आप neurologist के पास जाते हो, या cardiologist के पास जाते हो, तो they are separate specialties. The dermatology is a different specialty.
Right.
Then we can come under the big mushroom of aesthetics.
Okay.
So there are a lot of doctors who have just done their MBBS and now they pursued aesthetics. They did not specialize in anything.
Okay.
So वो एक different field है, and we are dermatologists and we are qualified aesthetic physicians.
Okay. Right. So now I'm sure that people come to you with all sorts of different ideas that they have. What do you think? I mean, which fashion is picking up more? Is it the Western fashion? Is it the Eastern fashion?
The Korean fashion.
I mean, I wasn't expecting that. The Korean.
It's the Korean fashion, the Korean chains, and the Korean beauty. That's like the Korean dramas.
Like, what has happened suddenly?
What has happened? Well, the Korean industry has bloomed a lot. They have worked a lot on their own thing. They haven't followed the Eastern fashion. They haven't followed the Western fashion. They have made their own brand, a Korean brand, and people love Korean things. Like, they want to look like Koreans. They think like those petite faces, those cute button noses, and the defined chains and all that. And I think in Pakistan, if somebody is anything closer to the Korean look, it would be Hania Amir. She has that kind of a look.
But it's a natural look that she has, right? All right, let's not comment. All right, let's not comment on that.
Yes.
Okay.
Nobody's natural nowadays.
Okay, nobody's natural.
Nobody's natural.
Come
It's
on.
on the TV, in the celebrity front. Nobody is.
Okay.
Everybody has gotten something done. But yes, the best beauty treatment would be which is undetectable. And a lot of them have gotten good treatments done.
And when we say that it's undetectable, of course, I mean, that would be a good beauty aesthetics treatment if it's blending in well with how your face is and all. But when you go through these treatments, what happens on the inside? Or, I mean, like, do you go through bodily changes as well? Or
I don't think you go through bodily changes, but it's more of a mindset change. People, I think what happens is
no, but you're consuming a lot of medicine. Like, that would also happen to
No,
people.
not
People who would go
necessarily.
through a lot of surgeries and all.
Okay, surgery part is something that I don't do. I'm not into plastic surgery, but even in plastic surgery, we don't give a lot of medicines.
Okay.
It's more of what we call it skin deep.
Okay.
So we treat it at the skin level. So not a lot of oral medicines, but yes, things that we do, like if you ask me about collagen, there's a big market boom of collagen kha loge and you'll have youthful skin. That's not possible. We have to induce collagen from the outside for the skin. We do different procedures for that. So it does not have an effect on your body as much as it has on your mind.
Okay.
Yeah, because once you start, then you start looking at other people. Okay, oh, isne ye karaya, let me get this done too. She's looking nice, let me get this done too. So you come back and you say, now I want this, now I want this. So you're always in a loop. Okay, what else should I get done to look better? So वो ख्याल से it gets more into an anxiety issues then. Anxiety होना शुरू हो जाती है.
Yeah, and then you're kind of forced to get more and more treatment.
Yes. It's not like we are forcing them, but it's just that
Societal pressure, or maybe the pressure that somebody has taken upon themselves.
yes, it's more of that.
Like, so has it ever happened to you that somebody came to you that I want this procedure done, and you advised otherwise, and they still got it done?
Yes, it has.
It has?
Yes.
Okay.
This 21-year-old girl came into my clinic. She had been coming in getting simple Hydra facials done and all that, but she wanted something more. And I refused her. I was like, "No, yaar, you're too young for it. Don't go for it now." She goes to some other clinic. They do her non-surgical facelift, thread lift for her, and I think lip fillers as well.
Okay.
2 weeks later she comes back and she says कि मेरी तो शक्ल पूरी बदल गई है, now what do I do? And you won't believe it, I'm looking at her face and I'm like, such a pretty girl she used to be, and what has she done? But I told her to wait it out now, tell everything, let everything go down.
Because that's not even her face.
Yes, that's not even her face. I'm like,
And she has to live with it.
so people do that, and वही बात होती है, if I refuse, somebody else will do it. But फिर ethics आ जाती हैं बीच में.
Yeah.
As doctors, we are supposed to follow ethics.
And they are also, I mean, the one that she had gone to would also be qualified doctors, right?
Of course.
But again, it's the difference of ethics between two different professionals.
Yes.
Right. And so when somebody goes through a problem like this, I think it also impacts the psychology. It also has a psychological toll on that person.
Yes, definitely. फिर you have to, I have to calm down with some people, you know. Okay, it's okay. It will be fine. It will be better. You have to work on it. We बात है कि it's not just what you're looking at. A lot of time you have to calm people down. Okay, you know, this procedure, this thing is not going to be for you what you are thinking of it as. Okay, वो जैसे अब it's AI, right? So a lot of Insta posts में they show you a picture before and after, which is AI modified, and they are like, oh, I want a face like this. Then you have to calm people down. You know, this is not humanly possible.
Okay.
So we are not going to be making you a doll. That's not what our aim is. So, but yeah, well.
And in a world that's increasingly being AI-driven and AI-integrated, how do you see the overall industry changing in the next 4 to 5 years with everything that's AI going to do? I mean, like, technologically speaking.
When I started off, it was like, this is the boom of aesthetics, you know. Okay, it's a boom and it's going to come down. But now that AI has come into play, there's going to be another boom now, because AI is telling people they should get this done. Like, people put in their problems. This is what, and people put in their picture, this is what I look like, and how can I look better? Then AI tells them this is how they can look better. Then they come up to you and they tell you, okay, oh, AI was telling me this, so how about you get this done? So yes, and because everything is so, social media is so readily available to everyone, and these things that they see one picture and they go to AI, then they come back to you. Like it goes around like this, you know?
Like a loop.
Yes, कि AI ने तो ये कहा था,
ठीक है,
मैंने तो ये चैट GPT किया था.
Okay.
वहाँ पे आप कहते हो कि okay, let's stop. Because AI तो कहेगा, AI has gathered information from all over the world for you.
Yeah.
कि ये भी करा लो, वो भी करा लो, लेकिन is it really for you?
Yeah.
So that AI, I think, has still failed to understand कि what they are selling maybe is not for them, the person who wants it to get it done.
Right.
And the human factor, of course, that does not, AI does not include that.
Yeah. But on the flip side, don't you think it has, I mean, social media and the increase of the use of social media and the access of it has kind of, you know, benefited the practitioners in the sense that, of course, there's a flip side of negative that we discussed here, but on the positive side, it's good for business for these dermatologists, because, like yourself, because now people are taking more care of their skin. They want to look better. There are other people that they want to compare themselves with.
So let me tell you this, what happens. Social media, the positive side that you're talking about, you will see an influencer selling you something. Get this serum for yourself, you have a glowing skin. You go down, another one comes up, get this one.
आज मुझे पैकेज आ गया.
हाँ. अच्छा. अब what happens is कि the young people especially, they don't know what they need and what they don't. वो influencers से influence होके, they get 10 things, and then they start applying it on their face. So many young people, they come sit on my table, in front of me, and they have faces full of acne.
Okay.
और जब मैं पूछूं क्या लगा रहे थे, they have this whole list.
My goodness.
Their skin barriers are destroyed. They have like totally अपनी skin तबाह कर दी. Then you have to stop everything. You tell them, please take a break. You don't need these things. और वो जब 2-3 वीक्स के बाद ठीक होके आते हैं तो कहते हैं आपने कमाल कर दिया. हम कहते हैं हमने कमाल नहीं किया. It's just that you're using too many things.
Right.
तो वो जो पॉजिटिव साइड है ना कि बिजनेस ग्रो करता है,
हाँ.
उसका एक ये डाउन साइड भी है कि जो बेचारा कंज्यूमर है ना वो बहुत
खराब
अफेक्ट होता है.
Right.
देन फिर उसको अगर ऐसा देखें, वही बात है कि फलां डॉक्टर ने वो फलां तस्वीर लगाई थी, उस पेशेंट इतना अच्छा लग रहा था, आई वांट दिस डन टू. अब आपकी पॉकेट है उसकी कि नहीं है, बट यू वांट टू गेट इट डन.
Okay.
तो वो फिर हम इकट्ठा कर लेंगे, आप बस बताएं कितना बजट है. तो
Okay.
इट्स मोर लाइक अ फास्ट फैशन बन गया ना कि अब ये भी कर लो वो भी कर लो.
Yeah.
तो उस तरह तो फिर वही बात आ जाती है. देन एक उसका एक और जो फ्लिप साइड है कि डॉक्टर्स, व्हाट डॉक्टर्स आर डूइंग, यंग डॉक्टर्स स्पेशली. पहले होता था अच्छा MBBS किए, अब स्पेशलाइज करना है, किस फील्ड में स्पेशलाइज करेंगे. अब MBBS में घुसते ही सबका माइंड सेट होता है एस्थेटिक फिजिशियन बन जाएंगे. स्पेशलाइज तो करने की जरूरत ही नहीं है ना. बस पैसे तो हैं तो पैसे लगा लेंगे और एस्थेटिक फिजिशियन बन जाएंगे, कोर्स कर लेंगे. So nobody is motivated enough to specialize.
Okay.
So that's also a bad side of aesthetics.
Okay.
कि specialize नहीं करना because फायदा नहीं नजर आ रहा. हम जल्दी प्रैक्टिस स्टार्ट कर देंगे, हम जल्दी मनी अर्न करना शुरू कर देंगे. तो ये भी एक
तो
डाउन साइड
अगर
है.
किसी कंज्यूमर ने लाइक किसी पेशेंट ने पहली दफ़ा किसी डॉक्टर के पास जाना है तो उसको वैसे क्या सवाल पूछना चाहिए अपने फिजिशियन से?
आपकी क्वालिफिकेशन क्या है? That should be the number one. एक तो मुझे सबका आई डोंट नो इफ यू वांट टू एड इट और नॉट, लेकिन एक जो चीज़ है, प्राइवेट स्कूल्स एंड गवर्नमेंट स्कूल्स, बिग डिफरेंस.
Okay.
प्राइवेट स्कूल्स मैं ये नहीं कह रही बुरे होंगे, देयर आर लॉट ऑफ गुड स्कूल्स टू, बट आई नो पीपल हु वर्क इन प्राइवेट स्कूल्स, डॉक्टर्स, एंड दे आर टोल्ड बिफोर हैंड कि बच्चों को तो पास करना ही करना है. और हमें तो रुला के पास करते थे, फेल कर करके पास करते थे कि अभी तक तुम्हें नहीं आता. तो अब जब बच्चे को पता है कि उसने पास हो जाना है, पढ़ेगा क्यों? तो एक तो ये बहुत ही वो है उसका, मैं कहती हूँ कि पता होना चाहिए कौन से कॉलेज से पढ़ रहा है.
Okay. Right.
ठीक
Yeah.
है. नंबर 2 के आर दे आर स्पेशलिस्ट और नॉट, MCPS या FCPS किया भी हुआ है या नहीं किया हुआ. तो बिकॉज अब तो डेंटिस्ट भी डर्माटोलॉजिस्ट है, अब आपका DPT भी डर्माटोलॉजिस्ट है, आपका न्यूट्रिशनिस्ट भी डर्माटोलॉजिस्ट है. एवरीबडी इज अ डर्माटोलॉजिस्ट बिकॉज एस्थेटिक फिजिशियन सबको बनना है.
वो जैसे होता है ना पाकिस्तान, एवरीबडी इज अ प्रॉपर्टी डीलर बिकॉज़
Yes.
वो सब आसान काम सारे कर लेते हैं.
Everybody is a car dealer, everybody is a property dealer, and now
Yeah.
every doctor is a
Dermatologist.
dermatologist.
Right,
वो-
right. Okay, so सबसे पहले ये because I think it's important for the patients to know who they're going
to, yes.
who is going to work on their skin.
Yes,
I think
exactly.
it's one of the most sensitive parts of our
When
body.
I wanted to specialize, मुझे ना फर्स्ट ईयर में नहीं मिली स्पेशलाइजेशन की सीट. तो मुझे बहुत सारे लोगों ने कहा कि छोड़ो यार, बस एस्थेटिक्स कर लो ये और वो और बस छोड़ो. तो मैं खुद सोचती थी कि यार हाउ कैन आई वर्क ऑन समबडी इफ आई डोंट नो व्हाट इज हैपनिंग इन द स्किन.
Yeah.
तो लेकिन
Confidence
की बात.
Confidence, right? Yeah, got it. And Dr. Maimona, last question. I mean, we've talked about women a lot, but have you seen that there has been a change for men as well? Like men have gotten more careful about their skin or more sensitive about their managing their skin. Have you seen that happen?
First, you tell me. You are a man. Have you been working on your skin?
I mean, I wash my face. I mean, that's what I do every day.
With the face wash or soap?
with a soap. I mean, I won't want to name the brand, but yeah, of course with a soap. Yeah.
वो हम आज भी हम मजाक कर रहे थे कि बंदे तो शैम्पू से भी धोआते हैं और कहते हैं हमने कमाल कर दिया.
Which is true for men, by the way. अच्छी बात है, इतनी टेंशन नहीं लेते लड़के. But like मेरा ख्याल है कि now it's changing. I mean, you can tell better.
Millennials में इतना नहीं है. Major concern for men has always been hair.
Hair.
Yes.
Right. Yeah.
Hair loss is something that majority of men come in for.
Right.
Or if they have scars, acne scars, वगैरह.
Yeah.
But yes, Gen Z is now getting into it. Now they want hydrofacials done. Now they want to
Okay.
have brighter skin like the girls.
Okay.
Well, I would say the Korean
Fashion.
trend is pulling them
Picking
into
up.
कि लड़के उनके भी चमकते हैं.
Yeah. अच्छा, so that's why.
Yes, तो वो everybody wants a glowing skin now. तो वो Gen Z में ज़्यादा है, but millennials not
और पाकिस्तान में Gen Z में है यही चीज़ ज़्यादा. Because
it's not as much as
Right.
it's internationally.
Right.
But yes, it's coming in slowly. पाकिस्तान में हर trend थोड़ा slow ही आता है.
Okay.
Yeah.
And so you anticipate that this could also happen in the next 3 to 4 years, where lads are also worried about
I would
their
want
skin.
the men वो हमारे ज़माने में कहते थे tall, dark and handsome. तो
Yeah.
वही ठीक है.
अच्छा, लड़कों के लिए वही वाला
Rough and tough
fashion
चाहिए,
ठीक है.
yes.
And this one's for men. Right.
Rough, guys should be rough and tough.
Rough and tough.
But yeah, if you want to have a cleaner skin,
Yeah.
good for you. लेकिन a lot of women bring in their husbands कि इनको स्किन केयर बता दें. तो मैं उनसे पहली बात पूछती हूँ बंदों से कि are you going to do what I'm going to write? And they laugh it off and they're like, what's up? लिख दे.
लिखते हैं. Time मिला तो सोच
तो
लेंगे.
सोच लेंगे.
Right. So, Ellen, thank you very much, Dr. Maimuna. It's been such a privilege to sit
No,
next to
it
you
was a
and
fun talk.
converse.
Thank you so much for having me.
And I hope there will be a second podcast where, in the next couple of months where we can discuss how the market has changed and how the trends are changing. And after Korean fashion, if there's a Chinese fashion as well, or if there's an Indonesian fashion too. And I hope there comes a day where there's good, decent Pakistani fashion for the world to follow.
We need to have our own fashion sense now.
Yeah, absolutely. I hope that happens, inshallah.
Because I believe our South Asian skins are the best kind of skins. We are not as depigmented as the Goras, and we are not totally dark. We are in between, and we have the best skins. We need to realize this.
Yeah, I think it's about self-realization.
Yes.
Yeah, and it has to be done in a collective manner as well. So maybe it's education as well with regards to aesthetics and dermatology.
Yeah.
Well, thank you once again, Dr. Maimuna, and thank you
so much.
everyone for joining us for this conversation. It was a bit different as we've discussed in the beginning from what we usually discuss, but I really enjoyed the conversation and got to learn so much about this world of dermatology, aesthetics, and how the fashion's changing as well. And I hope there was a lot to learn for you guys as well. If there are any comments, we would love to hear from you guys. Thank you very much. Take care. Allah Hafiz.